It's amazing, it's extremely high tech, and it's one of a kind. I'm Dr. Christopher Baer. I practice in Lone Tree, Colorado. I've been there for about 5 years. I'm a COIS trained doctor, and so we've been doing cosmetic treatment, full arch rehabilitations, and we'll do simple kind of bread and butter dentistry, crown and bridge, fillings, hygiene, and all of that stuff. I've been using Oryx for a little over 10 years now, and we've been kind of progressing with Oryx as it's developed in its kind of infancy all the way up to where it is now. What prompted us to switch over into Oryx was kind of an evolution. When I started my practice, I started it from scratch, and we went into utilizing a software that was kind of relatively new. It was called Mac Practice, and I was a Mac fan since birth, and so I was always into technology, trying to have a software that would do all of the things that we wanted to do. Being a COIS trained doctor, I knew different things and modalities we wanted to try to implement for how we provide a risk assessment to patients. Unfortunately, we weren't able to stay with the software because it wasn't evolving fast enough. A lot of the features that they told us that were going to be available to us never came to fruition, or it was just taking too long. So then we transitioned to a secondary software, which was cloud-based, which offered us a lot of opportunities to get rid of a server, cut down costs, and I saw the power of that software and what it could do to transform the practice and how we acquired the data. The way that Oryx was able to capture all of the data that we needed, it became a no-brainer for us to transition into a software like that because it's an evolving software. Day-to-day operations, the workflow for everything just becomes seamless. Once people learn where all of the critical components are, I think they buy into the software and then they make the office successful just by using it. It really comes down to team buy-in, because the more the team buys into the software and sees how powerful it is, the better everything becomes. It's laid out in a fashion that if people have used dental software before, they'll pick it up really quickly. And they're like, oh, hey, you know what? Like, I'm used to finding this. I know where the clinical chart is. I know that, hey, I'm a clinical person in the back, so I know all of the stuff that I need is right in this column. I can just click down the column and I can go through all those things, and that's all the doctor's gonna need from me. I can quickly find notes. I can quickly find x-rays. If they're related to the front desk, they're like, hey, all of my front desk duties, they're right here. I know that I have a little tab over here that I can come in and I can use this as like my to-do list for the day. And if people understand that and it's explained to them, then they start to see the power of having one system. Once the team sees how simple it makes their life, then I think you start to see the true power of Oryx. And then when they come back and they have those aha moments and they're like, hey, did you know that the software could do this? So Oryx has definitely helped streamline all of the way that we bring in the data and for treatment planning. The reason why we want to do things in a set kind of checklist, regimented fashion is because we can gain clinical efficiency, but also not miss things while we're trying to input all of the data. If you have that system, which the Oryx system essentially guides you through all that process, because you're just going through from one window to the next window to the next window, then you're going down all the columns, checking all the boxes. You're getting all of that data, and it's just like going down a checklist. If we're going through that system, we're not trying to go back and be like, oh, where was I? Was I doing, restoration charting? Was I doing perio charting? Was I trying to get all the sizes of the restorations? It just becomes really quick and efficient because of how the process is laid out. So it actually streamlines the workflow and makes it a lot more efficient for the patient examination process, and you're not missing anything. What we wanted was just to be able to focus on just the clinical stuff. That simplifies everybody's life and makes things easier for patients. We've seen a dramatic improvement in case acceptance because of the way that we can present the information. Oryx by dentists for dentistry.